I'm going to show how to do a head to toe assessment today. I'm going to make sure that we have all of our supplies, anything to do vital signs with. Introduce yourself, follow all of the safety and general principles. Explain what you're going to do. We're going to review his demographics, which is going to be name, age, address, sex, race, religion, his current health history, so any substance, drug, alcohol use, history of diabetes, cancer, if he has diabetes, if it is controlled or not, family history, which would be history of heart disease, diabetes, cancer, what brought him in today, so his chief complaint, how long that's been going on for, what makes it better or worse, what it feels like, and then medications. So medications, you're going to include stuff that's prescribed to him, herbal medications, over-the-counter medicine, and you're also going to want to review his allergies. So for vital signs, you make sure you have the appropriate equipment or automatic equipment. I don't have a blood pressure cuff, so I'm just going to kind of wing this part. For blood pressure cuffs, you would apply it on his arm and put this underneath on his artery, pump it up, and listen for when you would hear the first beat, and then the last one. The first one would be your top number, your systolic. The last would be your diastolic, or if you had an automated blood pressure cuff. You're going to watch and count respirations. Note if they're labored, even, uneven, if he's having any distress. For temperatures, you can do them orally, rectally, axillary, temporal, tympanic. Note if they're elderly, it's probably going to be lower. For pulse ox, you just apply this to their finger, one of their toes. And then for pulses, you can either apply pulse ox, if they're on cardiac monitoring, on telemetry, then that will show on the screen, as well as their blood pressure. And then the other way is to check their pulses. So you check carotids one at a time, their brachial pulses, radial. Listen with a stethoscope for an apical pulse, which is the most accurate way, for a whole minute. And then you have DP and PT pulses in your feet, your femoral pulses, and popliteal pulses. Make sure that you document if those are regular, irregular, if it's fast, tachycardia, low is bradycardia. Fast breathing is tachypnea. Slow breathing, decreased respirations is bradypnea. And then you would go into the head to toe assessment.